Metacarpal fracture of the hand, symptoms, treatment, and complications. Metacarpal fractures of the hand are a common injury that can significantly impact one's ability to perform daily tasks. These fractures occur in the bones that form the framework of the hand, connecting the wrist to the fingers. Understanding the anatomy of the hand and the way it functions is crucial in comprehending the implications of a metacarpal fracture. Any damage to this area requires immediate attention and appropriate care to ensure a full recovery. What is a metacarpal fracture? A metacarpal fracture refers to a break in one of the metacarpal bones in the hand. These fractures vary in severity, from simple breaks that may heal on their own to complex ones requiring surgical intervention. Metacarpal fractures can result from direct trauma to the hand, such as from a fall or a sports injury. In particular, the fifth metacarpal, known as the boxer's fracture, is often injured during fistfights or by punching a hard object. Diagnosis of a metacarpal fracture typically involves X-rays to determine the type and extent of the fracture. Understanding the different types of metacarpal fractures is crucial for determining the most effective treatment plan. What are the common symptoms of a metacarpal fracture? The primary symptoms of a metacarpal fracture include pain, swelling, and bruising. Patients may also experience a decreased range of motion in the affected fingers or hand. It's not uncommon for individuals to hear a snap or feel a pop at the moment of injury. Visible deformity, such as a bent finger, may also be present in more severe cases. Any suspicion of a metacarpal fracture warrants immediate medical attention to prevent long-term complications and ensure proper healing. What are the treatment options for a metacarpal fracture? Treatment for a metacarpal fracture can vary from non-operative to surgical interventions, depending on the fracture's complexity. Non-operative treatments may include immobilization with a splint or cast. In cases where the bone is displaced or the fracture is unstable, surgery may be necessary to realign and stabilize the bones. Surgical techniques can involve the use of pins, screws, or plates. After the initial treatment, rehabilitation exercises are essential to restore strength and flexibility to the hand. Patient adherence to rehabilitation protocols is crucial for a successful recovery. How long does it take for a metacarpal fracture to heal? Healing times for metacarpal fractures can vary, typically ranging from 3 to 6 weeks. However, this period can be extended if the fracture is severe or if surgical intervention is required. It's vital to follow up with healthcare providers to monitor the healing process. Patients should also be aware that full recovery, including the return of hand strength and function, may take several months. What are the risks and complications associated with metacarpal fractures? While most metacarpal fractures heal without issue, there are potential risks and complications. These can include nonunion, malunion, or stiffness in the hand. Infections and nerve damage are also concerns, particularly with open fractures or surgical treatments. Preventing these complications requires proper care and adherence to treatment plans. What is the recovery process for a metacarpal fracture? Recovery from a metacarpal fracture involves more than just bone healing. It includes pain management, reducing swelling, and progressively regaining hand function. Initial rest and immobilization to allow bone healing, followed by gentle exercises to prevent stiffness. Gradual reintroduction of strength training. Consistent follow-ups with healthcare professionals to monitor progress. It's imperative for patients to actively participate in their recovery, as guided by their healthcare team, to achieve the best outcome.